selected cases by parathyroidectomy. Hyperpituitarism. There is an excessive hormone secretion by anterior lobe, which results in profound generalized effects on bone. It depends on the state of skeletal growth and type of abnormal cells in gland. For the eosinophilic adenoma, there is gigantism after growth that results in acromegaly. For basophil adenoma is the Cushing syndrome. For hyperpituitarism, for gigantism, there is an eosinophil adenoma that stimulates epiphyseal plate growth remarkably. It is usually associated with subnormal sexual development, and there is also an adolescent coxaphara. For acromegaly, in eosinophil adenoma cannot affect longitudinal growth of mature skeletal, instead stimulate circumferential growth from periosteal intramembranous ossification. There is a coarse facial features and thick fingers. In Cushing syndrome, it is associated with severe and progressive osteoporosis. There is obesity, moon face, increased body hair, and hypertension to hyperadrenocorticism. In primary Cushing syndrome, there is hyperplasia or neoplasm of adrenal cortex. In secondary Cushing syndrome, there is a basophil adenoma of anterior lobe of pituitary or prolonged cortisone. For the lab test, we could find dexamethasone test and ACTH. In hypopituitarism, there is a dystrophia adiposogenitalis or Froehlich syndrome. There is a prominent obesity, subnormal sexual development, relatively normal growth, and a predisposition to slipping of the upper femoral epiphysis or adolescent coxaphara. There is a deficient amount of pituitary hormone in hypopituitarism during childhood. Retard epiphyseal growth and laurentate of dwarfism. Hypothyroidism in childhood or cretinism. It is a congenital deformity of thyroid function that results in delayed epiphyseal plate growth and delayed and irregular ossification of epiphysis. There is also mental impairment, large tongue, dry skin, dull facial expression. For the early recognition and treatment of hypothyroidism, great improvement of all aspects. Screening of TSH make cretinism less common. Disseminated bone disorders. Widely disseminated but discrete lesion in bone. Not associated with generalized one disease. Include polyostotic fibrous dysplasia, Paget's disease, Langerhans-Sells histiocytosis, and Gaucher's disease. In polyostotic fibrous dysplasia, probably developmental faulty of bone development from somatic cell mutations of genes coding G or mediate parathyroid hormone action in bone. Multiple areas of fibrous tissue replacement within multiple bones without generalized osteoporosis. The pathology of polyostotic fibrous dysplasia. There is a slow progressive lesions from early childhood, weakening of the bone with variant monostotic fibrous dysplasia and McCune-Albright syndrome. To diagnose the polyostotic fibrous dysplasia, it could be diagnosed from early childhood, pathological fracture or deformity, and also if we found the progressive radiographic changes. For treatment, there is no specific treatment yet, but operative for pathological fracture and bony deformities. In Paget's disease, it is a slowly progressive enlargement and deformity of multiple bones, associated with unexplained deposition and resorption of bone. It is extremely common, 4% of people older than 55 years. There is also a genetic disposition. The etiology is slow virus affecting osteoclast. Pathological process significantly accelerated bone turnover. The involved areas of bone are extremely vascular, arteriovenous shunts. In early phase, resorption is larger than deposition. In tibia, femur, pelvis, vertebral bodies, and skull, it is the most common site that is affected. For the progressive deformity resulting from enlargement and bending of bones in the osteolytic phase, degenerative arthritis of nearby joints, pathological fractures, and occasionally malignant change to osteogenic sarcoma. In diagnosis, Paget's disease for the common and milder form is more common. It is usually subclinical and do not cause symptoms. For the severe form, there is a distressingly severe bone pain, progressively bald lower limbs, and gradually larger head. In technetium bone scan, here we can see localizing the area involved. For the radiographic, we can see enlargement, deformity, and porosity of involved bones, increased and irregular density, elevated serum alkaline phosphatase and urinary hydroxyproline level. The treatment of Paget's disease involved no medical treatment is specific for this disease. It is usually with anti-resorptive treatments, amidronate, alendronate, and plicamycin. The histiocytosis. There is a proliferation of reticuloendothelial cells within bones. There is the non-lipid histiocytosis and the lipid histiocytosis. For the Langerhans cells histiocytosis or histiocytosis X, there is lateral sievous disease. In lateral sievous disease, there is an enlarged spleen, liver, and lymph nodes. There is also a thrombocytopenic purpura with petechial hemorrhage, usually results in early death. For the Hans-Schüller-Christian disease, there is a disseminated proliferation of histiocytes within the bone. It results in destructive lesions, particularly in the skull, but also in other bones. When the involvement is extensive, it usually has poor prognosis. Other type of Langerhans cells histiocytosis is the eosinophilic granuloma. It usually occurs in children and young adults. There is a single osteolytic lesion and also a pathological fracture. In clinical and radiographically, it is a great imitator of several bone diseases. It is similar to osteomyelitis, tuberculosis, simple bone cyst, fibrous dysplasia, and various malignant bone neoplasm. It usually has good prognosis, and to diagnose the histiocytosis is with C100 protein and berberine bodies. For lipid histiocytosis is the Gaucher's disease. There is an inborn error of lipid metabolism, hematopoietic changes, and there is a poor prognosis in early childhood manifestation. For the therapy, usually involved in radiotherapy, that results in regression of the bony lesions. Splenectomy is to relieve local discomfort, and there is also bone marrow transplantation if needed. Thank you for listening.